More than 300 million people suffer from depression worldwide. It is considered one of the most emotionally painful experiences anyone can go through.
But the FDA recently approved a study to test what could be a breakthrough drug to treat it right here in Madison. Only News 3 Now's Jamie Perez takes us on this journey.
So this is the first step.
For researchers at the USONA Institute, this is just another day in the lab.
So I'm reacting that acyl chloride, dimethylamine.
But they're making a substance that could change the medical field.
We're kind of building the psilocybin molecule from the ground up.
Psilocybin, the active ingredient in magic mushrooms. You may be wondering, how can this lab-made yellow substance help heal depression?
It's one of the most fascinating questions in the human world right now.
Charles Rayson with the USONA Institute is on a journey to find out.
I think right now the evidence suggests that a single treatment or two treatments of psilocybin in many people will have a benefit that will last at least several months and maybe longer.
Just ask Diane Byler.
I was 50 before I did any of this.
She's a former subject in a previous psilocybin study done at UW-Madison and formerly a skeptic of mind-altering drugs.
My brother and I saw other people experiment with some of that stuff, and that just wasn't for me.
Byler signed up to be a part of a psilocybin study for healthy adults in 2015 after dealing with some mental struggles.
My mom had passed away earlier that year, and I was actually in the process of a divorce, too, at the time.
In an attempt to heal herself from within.
There was an 8-hour music playlist that they played each time, so it was the same music each time, and I put on headphones and eye shades and just went in.
Byler went on a journey that she said changed her life forever.
Ultimately boiled down to interconnectedness and love and oneness and wholeness.
As she lay here for 8 hours on her journey, she wondered the same thing that researchers are seeking answers to today.
What about that could possibly be so powerful that people feel changed a month later, 2 months later, 3 months later? And the short answer is we don't know for sure, but the data to date suggests that it is the quality of the experience that's induced acutely in that 6-hour psychedelic window that really predicts how people do long term.
Would you say that this could help people who are depressed?
Absolutely. To actually feel it and process it, they say the way out is through. So instead of just stuffing it down, to actually have a safe place to process whatever it is they need to process.
For Rayson, this isn't about doing drugs in your backyard. It's about real, powerful medical experiences to heal one of the most emotionally crippling diseases so many of us face.
The difficult experiences are often difficult in a way that helps people begin to face the experiences, resolve the experiences, get a different perspective on the experiences.
Rayson said the drive to get treatment from depression is profound, and his team of researchers,
That yellow color is going to start to disappear.
are testing something that could eventually treat other mental health conditions.
There are studies now suggesting it may help people quit smoking. There are studies suggesting that it may help people get some relief from alcohol dependence. There are studies suggesting it may be helpful for people that have obsessive compulsive disorder, which is a very difficult condition to treat psychiatrically.
Until the FDA approves psilocybin as a legitimate treatment, Rayson is hopeful that this actually works.
If the data hold true, this is a revolution in mental health.
In Madison, I'm Jamie Perez, News 3 Now.
Right now, they are in the screening process to find 80 people to participate in this study. Several other studies still need to be done before this can hit the market.
For more information on this or to find out if you qualify to participate, we have a link with more information at channel3000.com.